Okay, we are going to get started. Good evening, everyone, and thank you for joining us for this Transition in Medicine Education Series webinar on how to succeed in your clinical rotations, hosted by ACOM's Residents and Fellows Council and the Council on Residency Placement. My name is Dr. Stephanie Zazutek. I am the Vice Chair of the AOGME Committee and Interim Associate Dean and Assistant Clinical Dean at the Touro College of Osteopathic Medicine in Great Falls, Montana. I will be the facilitator for this session. Before we get started, I would like to review a few housekeeping notes. The opening panel will be recorded and available to view on the AOGME web page within 7 days. The breakout sessions will not be recorded. Please feel free to submit questions using the Q&A function at any time. Please remain muted at all times during the opening panel. You will be able to unmute in the breakout rooms to ask questions to the breakout session panelists. If you experience technical issues, please use the chat feature to notify us and we will assist you. I would now like to thank the panelists who joined us today to speak with you for the opening panel as they share their experiences, perspectives, and advice for succeeding in clinical rotations. We're going to start first with Dr. Abigail Frank. Please introduce yourself and let us know the program that you're with.
Hello, I'm a family physician by training. I'm the Associate Dean of Graduate Medical Education at the West Virginia School of Osteopathic Medicine.
Next, we'll go to Dr. Caroline Roddy. Carolina Roddy.
Yes. Hi, everyone. So yeah, my name is Dr. Roddy. I am with University Hospitals in Cleveland, Ohio, that they work in partnership with Case Western, and I'm a first-year child and adolescent psychiatry fellow. It's first of 2 years total, and I'm happy to answer all the questions you guys have.
Okay, next we have Dr. Hanson Tang.
Hi, everyone. I'm Hanson. I'm one of the PGY3s from Western Michigan University in internal medicine, and hopefully I can help answer any questions you guys might all have. I'm glad to be here as well.
All right, next, Dr. Omashadi Idowu. Please correct me if I didn't say it the way you want us to say it.
Oh, that's fine. Dr. Omoshadi Ido is perfect. So I am a emergency medicine PGY3 at Jefferson Einstein Philadelphia Hospital in Philadelphia, Pennsylvania, and also your policy chair for the Residents and Fellows Council. So happy to answer questions about that as well in the future if you want to email me.
Great. All right. Well, welcome, panelists. You may see a few people who are not here today. They weren't unable to join us, Dr. Bree Howerton and Dr. Maria Rinaldi. So we're going to jump right into starting with some questions. The first one is, I want everyone to give their top 2 to 3 tips for succeeding in core clinical rotations and or away rotations. We'll start with you, Dr. Frank.
Thank you. I would say one of my top advice is don't just use VSLO, the Visiting Student Learning Opportunities, to search for away rotations. I highly encourage applicants to use either Residency Explorer or FRIDA. Pick your specialty, pick your location, pick 10 to 12 programs you're interested in. And I think that's a great way to find programs. If you just use VSLO, not all programs use VSLO, so you may miss some really great institutions.
Okay, next, Dr. Roddy.
So don't be afraid to also be creative. And if, let's say, you want a specific program and let's say you live in that city, if you can find ways to tie why you want that to they should offer you a spot, they are more than happy to listen to you. That's what actually happened with my emergency rotation. I didn't want to go anywhere else. I wanted to stay home. I was tired of traveling, and I just appealed to my local hospital. And it was a very slow process, but I never gave up, and it ended up happening. So don't be afraid to just knock on doors, knock on windows, and ask. The worst that can happen is no.
Okay, next, Dr. Tang.
Yeah, 2 tips I would give for everyone that's going through clinical rotations is just always try to be curious. Make sure to ask questions. Don't ever be scared about getting things wrong, because honestly, at your stage of training, it's normal. And sometimes just by asking those questions, you'll learn a lot about the program or the residents, and it'll really open up lots of, I guess, opportunities and a whole new world for you. So really, with any program you're at, try to really envision yourself being there, even if you don't think it's your first choice or your top choice. I would say give it all your best in every single one, and I think that um, most people respond pretty positively to that.
Okay, great. And then Dr. Dogu?
So I agree wholeheartedly with everyone else's tips. I would also say before you start that rotation, go through your step book and maybe read that chapter for emergency medicine or trauma or surgery and just kind of review that material. So you have like some of those common things that are going to probably come up as far as asking you questions. I would say agree with using unconventional ways to get your rotation, especially at places that may not be in the state that you want to be in. So apply it, I mean, go to their open houses, and then after the open houses, email the program director, just ways to start showing your interest early, soon, and often. And then enthusiasm is always appreciated. Like I love when the medical students come in enthusiastic for every rotation, even if it's not their specialty of choice.
Wonderful. I have a couple of tips myself that I want to share with the students. So one of them is, if you don't know something, that's okay. However, to leave it at, I don't know, you shouldn't leave it there. You should say, but I'm going to find out for you. And can I get that answer for you later today or tomorrow? Your preceptors will love that you are taking initiative. It may be a challenging topic, or maybe something that maybe there's a new technology, a new diagnostic opportunity to help the patient, and they're just checking in to see what you've been learning on in your classes and may be able to apply it to. So it could be from many different ways that you can learn a lot just by checking out the answer to that. So I think that was always really helpful, and it just shows that you're a team player. And I know we're going to touch on this a little bit throughout this rotation, but whether it's the rotation that you want to go into or not, it's still the same type of thing to take a look. You never know when you're going to have a patient in the field that you're in that might have a situation that you'll need to refer them or just have some better understanding of what the patient's going through. Other things that I think are really important is, right, just be open-minded, take a chance on something that, you know, maybe it's not just the hospital and the location, but it's also the people that are there. And if they love to teach, you're going to have a wonderful experience no matter where you go. And so whether it's rural, suburban, urban, whether it's a large or smaller hospital, I think you get a little bit out of all of the rotation opportunities. Okay. So we're going to move on to another question right now. We'll just have the panelists jump in if they want to give some tips of advice. What should one look for when selecting their audition rotations?
All right, I can start there. I always made it a point to kind of get a feel for the culture and how they relate one with the other. The vibes I was picking up on, the frustration of the staff, or the joy of the staff of working there. That really did tell me a lot about what's going on underneath that nobody's talking about.
Dr. Frank?
Looking at the program's website or looking for the program on social media can sometimes give you some insight about a program. Oftentimes, if you pick a specialty and pick a state, there might be 20 programs in that state. And if you know, and if you're not sure where you want to be, I think it can be difficult to pick between programs. So I think some of those tools can help.
Any other words of wisdom?
So for me, I paid attention to the education, like the conferences that people had each week. Like, how much did you learn from that? How deep and detailed and I guess exciting almost. Like, how do they teach? Is it very like just PowerPoints, or do you have a lot of mix up of simulation or mix up of interactive things or changes to the different types of learning styles? Like, do they appeal to different learning styles, or are they very linear? I think that helps to see whether or not a program is going to be well-rounded enough for you and meet your learning needs. So look for how they're teaching matches with what you're looking for.
And I agree wholeheartedly with everyone else. Very good advice. And then I would just add if you have any like members of the class above you who might have been through the same process, who might be applying to the same specialty, sometimes they can help you out and tell you specifically what to look for as well, at least in your own particular specialty, and then which programs they really enjoyed. And that might help you also determine where to go.
Okay, a question did come into the chat, so let's jump to that real quick. For students that will have co-rotation at sites with very limited resident exposure, for example, residents in only psychiatry or pediatrics and the rest are with attendings, how can they use this type of circumstance to their advantage and not be limited in preparation for audition rotations or residency?
So when I had that situation happen, I kind of really focused in on the attendings. How was their residency program? What things did they look for? Just picking their brain and letting them get to know me getting to know them. Because by the very least, at the end, you learn some wisdom pearls. And two, if it's a great rotation or it's a strong attending, you can get a great letter of recommendation.
That's very good. And even if you're in another rotation at the same facility, many times they will have grand rounds or they may have some type of educational workshops that students can join during lunchtime or before, morning or after, at the end of the day. So take advantage of those if you're able to, if time allows for you to join those sessions. Okay, should we move on to the next question? Okay. All right. Many students have concerns about scheduling and navigating clinical rotations. How can students best utilize resources like Vislo, Residency Explorer, and Frida to plan ahead and make informed decisions?
I have a couple of tips for those. I like Frida in that you can see right on that first page the percentage of DOs in that each program. So I encourage students, DOs make up 20% of all about 20% of all US graduates. So a program that takes DOs based on numbers has about 20% in their program. If they had more than 20%, well, then I consider that a safety program. If they have less than 20%, I consider that a riskier program. So I encourage students to apply to some risky programs, right? Because those numbers are never going to change if we don't apply, but then also apply to some safer programs. And then also, I think residencies like real estate. So a residency program in North Dakota, and no offense to anybody in North Dakota, might be less competitive than a residency program in Hawaii. Has nothing to do with the program, but it has everything to do with location. So make sure that when you're applying for auditions, that you're applying for some places that are in really nice locations and that are maybe in maybe less desirable locations.
Dr. Dova?
I mean, she kind of said one of the things I was going to say, but I use primarily Vislo, so I would say, but I also used independent like reach outs personally. I'm sorry, I don't have additional to add because she covered it.
Okay. Well, sounds like, some very common programming, but some sites do want you to reach out directly to them to schedule these types of rotations. There's also Clinician Nexus, which is another one that you can add to the list of sites to view to find some rotations. Word of mouth, upper class people, all of the above, right? All right. Any other tips for any concerns about how students navigate clinical rotations by utilizing all of these resources?
Real quick, just to add, I would pay attention to those like deadlines and when those applications open and when exactly they close. Sometimes it's in your advantage to apply as soon as possible, especially if it's something that you are particularly interested in. So I don't know if they change every year or when I applied, but yeah, I would just take a really good look at which ones are due first and then try to prioritize from there, which ones to apply first for.
And have a backup plan, because that time that you want to go may not work, but if you have another plan that you can switch it with, and another program may have more flexibility, so you just need to really navigate that.
Oh,
Someone did ask, oh, was there another tip
yeah.
there?
I was actually going to say, look for some of the scholarships that are available, especially if you want to do something that's away. I think that I did originally underutilize that when I was first looking for programs, but once I saw that there was those opportunities, it helped to offset some of the costs and limitations of wanting to go to a place that was further away, but you actually really wanted to be. And it allowed you to offset that cost, and then also they saw you're interested more so because you're willing to travel to them. And then like she just said, checking your schedule to make sure that your weeks of that rotation align with theirs, but don't let that limit you. Also reach out to the program, because sometimes they'll allow a week of overlap with another student, and then you have the other 3 weeks where you can actually have your dedicated time. So be willing, see if your school can be flexible, and also see if the program can be flexible for your schedule.
Exactly. Just to tie into the VSLO, there was a question here about when can we expect to hear back from programs if they are not on VSLO, or even if they are on VSLO, what's like the normal time frame to hear back? And we are emailing them to express interest in audition rotation. So I guess bottom line is, when can students can expect to hear back?
I think this is an awful answer, but it depends. I mean, some places are really good about getting back to you right away. And I've had programs that, will tell you, we'll wait till 2 weeks before the rotation starts to tell you that you're approved. I encourage you that if it's been more than a month, to reach out, or 2 weeks, depending on how patient you are. Reach out to the program, reach out to the person who is listed as the contact. If you can't find the contact, you can always reach out to the program coordinator for the residency program.
And just to add in, if at first you tried to get a program and it was not available and you're still having some difficulty, you can always reach back out, because sometimes they do get a cancellation and a spot can open up. So it doesn't hurt to recheck at times if it's something that you're very interested in and there's a possibility. And yeah, I see some answers in the chat, how, as early as possible, you should start to apply for these programs when things open up. And it's not just you clicking on the name of the site or the program, but you will need transcripts. You're going to need to upload other documents, and some of them will be directly from the student, others will be from the school. So you really want to make sure that you put your information in as quickly as possible to get your schedule set. Any other tips on that? Okay, so we're going to move on to the next question, which is, what is the best way to stand out during rotations? Now, I want to just add a couple points before the panel jumps in on that. So some of the things, when I had students with me, I love it when you can develop differential diagnosis if you're seeing a patient and discuss that with your preceptor. Practice presenting. Really summarize it in a succinct way so that you really get to the heart of what the issue is for the patient presenting. And when you do this more often, you get better, more efficient at it, and it really helps the flow with the patients. In fact, you're tending to be like, I would like that student to be with me on call tonight because they're doing such a great job. Review the most commons. So if you know you're on pediatrics or OB or emergency surgery, whatever it might be, what are the most common things that are seen with that? Take a look, get some background information, refresh from what you learned in school during your preclinical years. If you come across a really interesting article on a case that you worked together with your attending, share it with the team, share it with the attending. And there are opportunities to work on a case study. So research opportunities, case studies, publications, and all those things that go along with anything like that. the opportunities are still there, and you may really get a chance to do national presentation, regional. Sometimes the hospitals will have research symposiums. You can go right back to the school if you're nearby. So lots of opportunities that can really share all that you're learning on rotations. And with that, I will open it up to the panel for the other best ways to stand out during rotations. Unless I said it all right there.
I suggest that you talk to everybody at the hospital. You talk to the lunch lady. You talk to the janitor. You tell them how much you want to be there. If there's any way to be helpful, if you're walking down the hall and you see a piece of trash, pick it up. If you're on a subsurgical specialty, help the scrub tech set up the room, help them clean and tear the room down at the end of the day. You never know when something small is going to end up being the thing that gets you the rotation. You know, I had an applicant who went on an interview. It was an in-person interview. They were waiting outside at the front of the building. They were talking to the janitor. They helped the janitor, you know, get the trash bag out of the trash can. The janitor called the program director and said, "Hey, your applicant's amazing. You should take them." And guess what? That's where they end up matching.
That's wonderful. I've heard many, many stories very similar to that. Absolutely.
Yeah, if it's a quality program, they're going to also focus on your professional development, and that's developing also your humility and your ability to consider the whole and the team. That goes into it.
I think I want to circle back. It kind of touches on one thing we talked about earlier, but definitely want to make sure that I think the biggest thing is to never lie or never be dishonest in your communication, like whether you're giving a presentation and things like so. If you didn't really check their abdomen, if you didn't really see edema or not, whatever you did not see, if you didn't do a part of the exam, that's perfectly fine. Just say, I didn't think to do that. Let me go back in and check. And I think that's the fact that you are willing to take ownership, like she's saying, with the humility, as well as then correcting, which as far as like what you don't know and looking something up. I think that that helps to show that you're teachable. And then when you're teachable, then you're the resident that people want in your program, in their program.
And then just one thing, I guess, from me is, I would say in terms of just excelling, I would just say like make sure that everybody gets a chance, I guess, to share or put their input in. I think sometimes like some medical students at times are a little bit too eager to talk over people or try to overcorrect interns interns and other residents. So just know that with rounds and everything, it's almost like a stage, and you do have to share it with the other people, which is okay. It's okay to share the stage with and let everyone have their moment, but just make sure that when you do have your moment that you're ready, you know all your patients, you know exactly what to say and what the plan is, and you can always run it by any of your other by any resident who's working on the service with you. We're more than happy to chat with anyone. So that's what I would add.
Great. Okay, so we're going to go on to the next question. What are the most common mistakes medical students make on clinical rotations, and how can you avoid making them? Like we touched a little bit on that, but just to elaborate more.
So getting too hung up on your insecurities is actually not cool. Usually the med students that I've seen doing that, like we all can see the places where they could improve, but it was just them that they wouldn't stop talking about it. And it's like, let go, move on. We're trying to help you. We're here for you. We haven't like booted you out of the rotation. Therefore, there's hope. Move forward.
Some things that I have seen are just students showing up late, being unprepared for the day. And it, once really doesn't make such a big impact. But if it's a repetitive situation, then it really can impact the day because rotations on the floor may start as early as 6 a.m. Cases in the OR may start as early as 6 or 7 a.m. So that means there's a lot of prep work that goes in beforehand. If you're on call and you're exhausted and you need a break, then let them know. I was on call last night, and would you mind if I rested for a bit and then came back for the next case. If there was something that you need to do, just talk to them and let them know, things like that. Another thing is just jumping right in, on the first day or two, asking for a letter of recommendation. Let them get to know you, but also share information that's really helpful for them. Give them highlights and tips about you and who you are as a person, what you're looking for, and your CV, send a picture, if you're emailing them or emailing the team that does, assist with letters of recommendation for, certain fields at the hospital. So really make it as easy as possible for them to not only get to know you, but have all the information at hand when they have to do a whole stack of letters. Yes, Dr. Doe.
One thing that I notice is not introducing yourself when you arrive for shift. I think that both talks about your confidence as well as wanting to get to know everyone as well, like everyone that's there. Like even if you just can identify like the intern and you introduce there, and then maybe they introduce you to the rest of the team or something. But definitely come in the room and let them know that you are there and you're ready for your shift and what your shift is, because that helps me to make sure I get you to take breaks, lunches. I have that on my mind because I'm not always aware of what your schedule is as a student when you come to visit.
Yeah, and she just reminded me of something else too. Pay attention to your residents' concentration needs, because if you're constantly and your resident has to tell you something, that's bad. I mean, it's not necessarily like life or death, but it's just not good.
Are you saying like reading the room, like saying like what are we doing right now? Is this the appropriate time to talk? Yeah.
Yes.
For sure.
Just to build on that, listen to your residents if they're interns or if you're the senior. Just make sure to listen to what they say. It's just bad habit to not listen and continue what you're doing if they're telling you to do the opposite.
And, it is a learning process. Different hospitals have different ways that they manage different things. So if you arrive at the OR and you step across a line that you didn't have all the right gear on, immediately back up and just say, I didn't see the line, versus saying, well, there wasn't a sign there. I didn't know this. That's not the time to do that. This is the time to back up and just say, I didn't see it. I apologize. I will, immediately correct this situation. And they're going to recognize that you it responded in a really professional and respectful way. Okay, we have a couple more minutes before we go into the breakout room, so we're going to try to get to a few more questions here. What characteristics are programs looking for in rotating medical students?
I'm a former program director, and when I had students come and audition, I was looking for somebody that was willing to be wrong, right? So if you gave a diagnosis or you suggested a plan and it wasn't the right thing, you were okay with that and moved on. I want somebody that's going to work hard, that's going to help the team out. If they gave you an audition, usually you meet their qualifications, right? You don't need to prove yourself. You just need to prove that you fit in. And if you don't know something, look it up and come back the next day and talk about it.
And something that, just to share about when, you as a human, share some of your loves and passions outside of even clinical. You may connect on something from certain movies or books or riding horses or flying a plane, whatever it might be. So there can be lots of things that you can connect at another level that just shows that you're, further well-rounded, and someone that is, on some downtime while you're waiting for the patient to come into the room or something else that may be going on, you can have a conversation that really helps to brighten the day. And one of the things someone had asked, one of the pre-questions was just if you could do it all over again and you went back, as a student yourself on the panel, what would you do differently, if anything?
I would take more patience.
I agree with taking more patience. I think helping out the team as much as you can is something that you can definitely do. Like I would say too, to add to that, just being open-minded, try to listen to everybody's opinions and yeah, try to really envision yourself or see what the program's like. And I think that'll take you really far. You just keep an open mind.
I would say to ask what the expectations are of me as a student in each rotation because they can be different. There are some programs that are like stand in the corner and observe and like really don't give you a chance to really get in there. And then some people are like, you do whatever you feel comfortable doing and then do that. Don't just say like if they say like, hey, if we have this come in, you can like for instance emergency medicine. They're like, if you have shears, you're more than welcome to jump in and cut off clothing with the rest of the team. Do that. I want to see you take initiative without me saying directing. I think that's something I would have done sooner and often and not being as timid earlier on in my rotations. I got more confident with other ones, especially when it came time to do my away rotations and my fourth year rotations.
Dr. Frank?
I think along those lines of setting expectations, if you're hoping to get a letter of recommendation on an audition rotation, set those expectations early. Whomever does your orientation or whomever you sort of report to on those first couple of days, say, I'm really hoping to get a letter on this rotation. What do I need to do? Who do I need to talk to? What do you need to see from me so that you can write me a strong letter? And then halfway through the rotation, you need to ask for feedback and to make sure that you're on track to get that really strong letter.
And
Yeah.
be open if they're going to share something with you that maybe is a tip for improvement. Take it and show them the improvement because that is something that's going to really resonate well with that attending as well. Dr. Roddy?
Yeah, I forgot what I was gonna say. But one thing is like the sensitivity that you collect in med school, kind of figure out a way to deal with it so that you come in with fresh heart, fresh receptivity, because if not, you're gonna be like super raw and you're gonna come off defensive. So definitely deal with that.
All right, so I'm loving all these wonderful tips for our students and future residents and future attendings. It is now time for the breakout room. So there were a couple other questions that were in the chat. Please ensure to ask them to the rooms and you can jump around to different rooms as you need to ask questions. And here are the 4 rooms. So emergency medicine, psychiatry, and so forth. So, okay. All right.